Good afternoon. Today we're going to discuss some updates to our reopening plan as we continue to see improvements throughout our hospital system and the percent of positive COVID cases in our testing continues to steadily drop. The Commonwealth, as everybody knows, the Commonwealth's been fighting a second surge of COVID-19 since the fall. This surge was particularly difficult due to the holidays, which put an added burden on our hospital system and spiked cases due to gatherings and travel. To protect the healthcare system and reduce the spread of new infections, our administration put additional restrictions in place before the holidays. Overall, we think it worked. Since the start of 2021, the Commonwealth has seen positive trends emerge as hospitalizations have decreased and the percent of positive cases has declined at a steady rate. At the same time, our administration has continued to ramp up testing statewide. In response, we listed the stay-at-home advisory and early business closure recently, and 2 weeks later, here today, we continue to see the same trends that we saw in the previous 2 weeks. Hospitalizations are down by 33% since they peaked in early January. There are 1,635 individuals in the hospital with COVID, which is down from 2,428 in early January. 333 patients are in the ICU, and the 7-day average of cases is also down by about 53% since its peak, from 6,120 down to 3,274. Effective Monday, February 8th at 5 a.m., tightened capacity restrictions that we put in place right after Christmas to limit many businesses to 25% capacity will be adjusted. All businesses that are currently limited to 25% capacity will be able to go to 40% capacity. In addition, the sector-specific rules for restaurants and close contact personal services, both of which were subject to the 25% capacity restriction that was adopted in December, will be updated to include the same 40% capacity requirement. All other safety guidelines remain in place for all industries. The Commonwealth overall will remain in Phase 3, Step 1 of our reopening plan, meaning indoor performance venues and indoor recreational businesses will be closed until the public health data further shows sustained improvement. And when we adopted the 25% capacity rule in December, we also tightened our gatherings order to limit indoor gatherings and events to 10 people and outdoor gatherings and events to 25 people. We're maintaining those limits for gatherings and events. They'll continue to be limited to 10 people indoors and 25 people outdoors. Lieutenant Governor Polito will talk a little more about the details on some of this in a minute. We know that these restrictions have been and continue to be enormously difficult for large and small businesses, their employees, and for individuals everywhere. But we're making progress in this battle against COVID, and everyone's hard work and preparation is now making it possible for us to continue to step back to what we might call a new normal. The biggest piece of that new normal is the process associated with vaccinations. And as of the end of the day Tuesday, over 1.1 million doses of vaccine have been shipped to pharmacies, community health centers, mass vaccination sites, hospitals, and to locally run vaccination operations. And 681,472 doses of vaccine have been administered. We're continuing to scale up our vaccination infrastructure across the Commonwealth, adding more sites, including in communities that have been hit hardest by COVID. We currently have 125 vaccination sites up and operating, and we expect to have at least 165 sites up by the middle of February. This week, over 120,000 new appointments were made available, including 55,000 new appointments at mass vaccination sites. 8 new Walgreens locations opened this week, including in some of the hardest hit communities like Roxbury, Mattapan, Dorchester, Chelsea, Revere, and Everett. Next week, an additional 30 pharmacy sites will add around 21,000 appointments, and these locations will be primarily in communities that have been disproportionately impacted by COVID. We're also partnering with trusted community providers like community health centers and local boards of health. in various communities around Massachusetts. Residents can visit mass.gov/COVID vaccine to learn when and where they can pursue a vaccine closest to them. Vaccines are getting to residents across the state. Case rates and hospitalizations are dropping, and people are doing a great job of stopping the spread. And as a result of the progress we're making, everybody needs to understand that we still have lots of work to do. And we're asking everybody to keep doing the things that have been working. Spending as much time as you can with what we would call your immediate household, wearing a mask, maintaining distance, and doing all you can to stay away from what we might call the informal groups where people don't wear masks, don't socially distance, and share food and beverage for a long period of time. The progress we've made is always welcome news, but there is still much to do, and we continue to provide significant support for our small businesses. As many people know, in October we launched a grant program with the Mass Growth Capital Corporation and the support of the legislature to put over $720 million into the hands of small businesses that have been directly impacted by COVID. This is the largest program of its kind in the country. And we've been continuing to get this money out the door to those small businesses that need it the most. Today we're announcing that almost $174 million of new money is going out the door to another 4,043 additional businesses in the sectors that have been hit hardest throughout this pandemic. These grants range in amounts from $10,000 to $75,000 based on the size and the need of the business. And they will help businesses that have been hit hardest by COVID, like restaurants and retailers, indoor entertainment venues, and help them meet their obligations around payroll, benefits, rent, utilities, and other expenses. To date, the Commonwealth has awarded more than $450 million to almost 10,000 businesses that operate in every corner of Massachusetts and that we depend on and our local economies and downtowns are built around. We're still processing applications for the remaining funds, which is roughly another $200 million, and the Mass Growth Capital team will keep working on this project to get these grants out the door to businesses as soon as possible. Both Lieutenant Governor and Secretary Keneally, Lieutenant Governor Polito and Secretary Keneally will talk about the details of this round of grants and next steps in their remarks. As we head farther into 2021 and look forward to putting what has been an incredibly difficult time somewhat in the rearview mirror, we're going to remain focused on continuing to stop the spread, rolling out and expanding our vaccine capacity, and reopening our economy. People's work is paying off on this one. We just need to keep it up for a few more months. Thank you. And with that, I will turn it over to Lieutenant Governor.
Thank you, Gov, and good afternoon. Our administration is pleased to see public health data continue to trend in the right direction, allowing us to ease up more restrictions on businesses due to COVID-19. Throughout the pandemic, our businesses have been incredibly resilient and creative to find ways to get by during a most difficult time. We are grateful for everyone's cooperation and commitment to keeping our Commonwealth safe. I can't say it enough. Keep buying and shopping locally. Support the businesses in your downtowns and your main streets. Buy your gift cards, pick up takeout. Just do everything that you can when you make choices about how to shop, how to dine, and how to support local businesses to keep things going for them. This last year has been incredibly tough, really tough for our friends in the restaurant and retail industries. And as more people get vaccinated over the upcoming months, we look forward to starting to get back to a normal feeling. As the governor announced, we're able to begin carefully lifting capacity restrictions for the businesses that had previously been required to operate at 25% capacity. Some examples include gyms and health clubs, libraries, museums, retail, offices, places of worship, and movie theaters, but with no more than 50 people per theater. For the full list of industries, please visit mass.gov. As with the 25% capacity rule, restaurant employees will not count towards the 40% limit. The same goes for close contact personal services. Employees will not count towards the 40% limit. A limit of 8 people per 1,000 square feet will apply for smaller businesses without an available fire occupancy capacity. There continues to be no capacity limits on manufacturing, construction, and laboratories. As the Governor said, the Commonwealth remain in Phase 3, Step 1 of our phased reopening plan. These changes will be effective Monday, February 8th at 5 a.m. While we are getting close to the light at the end of the tunnel, we know that businesses across our state, in your downtowns, on your main streets, need our help and support. So you'll do your part, and we'll continue to do our part in processing needed funds to get into their hands to literally keep the lights on, meet payroll, and pay expenses. As the Governor stated, we are pleased to award financial support to 4,043 additional businesses today. Throughout this process, our administration and Mass Growth Capital Corp have been committed to ensuring that the businesses receiving grants represent the priorities set out for the programs. I do want to also thank Mass Growth Capital and the whole amazing team over there for reviewing and vetting and turning these dollars into the hands of business owners. I know how hard you're all working there. Over 1,300 restaurants, bars, caterers, and food trucks are getting grants this round, as are more than 1,200 businesses in the personal care and beauty sector, 554 independent retailers, 462 event support companies, 371 gyms and fitness centers, and 124 indoor recreation and entertainment venues round out this particular round of awards. Nearly half of today's grantees are women-owned businesses, a third are minority-owned, and about a quarter have not received any other relief. Our hope is that these grants will sustain the over 9,900 businesses awarded to date in order to get through these upcoming weeks and months. Before I turn it over to Secretary Keneally, I urge businesses, residents, and everyone across our Commonwealth to hang in there. Even as we ease up restrictions, we must continue to be vigilant and careful and do the things that we all know work: wearing a mask, washing your hands, and maintaining distancing, and obviously taking care of one another. With that, I'd now like to turn it over to Secretary Keneally, and I also want to thank him for his leadership on this program and all of your support for our business community. Thank you.
Thank you, Governor and Lieutenant Governor. Thank you for your comments, Lieutenant Governor. Very much appreciate it. Since announcing the COVID-19 Small Business Grant Program in October, and then the sector-specific relief grant program in December, a lot of time and effort has been placed on ensuring that businesses in need across the identified demographic and sector priorities not only knew about the program, but also applied. This work required partnership with great organizations that have strong relationships and networks in their communities. And we are proud of the diversity of the now almost 10,000 businesses that have received over $450 million in grants. And while MGCC endeavored to make the application as simple as possible in order to get money quickly into the hands of businesses, there are businesses that submitted applications that are incomplete. But initially uploading an incorrect document, for example, should not prevent a struggling business from accessing aid that they are eligible to receive. This week, MGCC will contact these applicants in priority sectors or demographic categories through their application portal to notify them that they have the opportunity to submit any missing paperwork. The incredibly hardworking team at MGCC is ready to respond to questions and to help these businesses complete their application in order to be considered for an award. We continue to encourage all eligible businesses to apply for relief at the federal level, too. So far in 2021, almost 23,000 Massachusetts businesses have been approved for PPP loans, totaling about $2.3 billion. Business owners can visit sba.gov PPP for more information on that program. Also on Tuesday, we announced the third round of the Shared Winter Streets and Spaces program, part of the Economic Recovery Plan released in October. This program provides funding to help Massachusetts cities and towns conceive, design, and implement changes to streets, sidewalks, and parking to support renewed commerce and safe mobility, with a special focus on the particular challenges of winter. The 21 projects receiving grants in this round stretch from the Berkshires to Martha's Vineyard, and they include awards to Danvers to reimagine their town center to enable recreation, dining, and socially distant gathering, the town of Hull to relocate parking, install more outdoor seating for restaurants, and upgrade sidewalks, and Southbridge to install new flashing beacons at existing crosswalks and convert a pedestrian plaza into a permanent community space for programming and an outdoor market. The fourth and final round of the Shared Streets program is now open for cities and towns to apply through February 26th. Thank you, and I'll turn it back to the governor.
Questions?
Governor, how concerned are you that this sends a message to people that things are completely safe?
Well, first of all, when we put many of these requirements and restrictions in place throughout the fall and into the winter, we did so with an understanding that we were going to follow the case counts and the hospitalization data and all the rest, and that we would then make decisions going forward on an incremental basis if the data got better. And the data has gotten better. And because the data got better, we are making some adjustments. These are very difficult decisions and very tough times for many people who are involved in these businesses. And I would just point out that the 90-minute time limit for dining is still in place. The 6-person max for indoor dining is still in place. Many of the requirements that we included as part of this initiative when we put it in place in the fall and in the winter are still in place. This is an adjustment associated with capacity effective Monday morning based on the fact that we have seen, as I said in my remarks, a 50% reduction in our 7-day average case count since its peak in early January, and a 35% reduction in COVID hospitalizations. We've also seen, as a result of our early initiative to vaccinate COVID-facing hospital workers and other hospital workers, a significant improvement in staff outages at hospitals around the Commonwealth, which has fortified the hospital community's ability to take care of COVID patients and, by the way, to take care of other people as well. I mean, at one point in time, we had enough people out either because they had COVID or they were quarantining because they were exposed to someone who had COVID that got up to about 1,500 to 2,000 beds. That number has gradually been coming back online as we've gone through this process, which makes the hospital community generally in better shape to take care of both COVID and non-COVID patients, which was important to us.
Sorry, does the vaccine availability factor into your decision, the vaccine being more widely available rather than just to hospital workers?
Well, let's face it, we have a long way to go on the vaccine rollout. Remember, there are almost 7 million people in Massachusetts, and, roughly speaking, there's somewhere between 4 and 5 million people who are ultimately going to be eligible to get vaccinated, and the group that we're currently working our way through has about 1.1 million people in it who need 2 shots, right? So the point I would just make there is there will be a heck of a lot more vaccination activity going on in in March than there was in February, and in April than there is in March, and in May than there is in April. The process on this is really just getting going. And when I say that, I'm basing that on the assumption that the production side of this and the Fed distribution piece is also going to grow along with that.
Governor, by doing this, are you not?
The numbers seem like they went down real quick. What do you think? I mean, obviously we've been talking about all the things that you did leading up to the holiday. Is there any science as to why people just not together anymore? Or why do you think it just went down so quickly?
You know, that's a really good question. And if you think back to the spring, it took a really long time for our hospitalization counts, our COVID hospitalization counts, to go down once we went over the peak. I mean, we were kind of on, the slowest slope line you could imagine for a really long period of time. We did not have anything that looked like the drop that we've seen over the past 3 or 4 weeks this time. And there are a lot of people speculating about what's driving that. And I think I'm going to leave I mean, we've talked a lot about it, but I'm going to leave the speculation on this one to others. I think it's a number of factors. And I can't stand here and tell you any one I think is more important than the other, because I'm not sure at this point in time that would be an easy question for anybody to answer. But there's no question that we have seen a much steeper decline in COVID hospitalization rates this time than we saw when they started to go down in the spring.
But is it directly correlated to your protocols and restrictions? I mean, do you think that you have been doing?
I think the decisions we made with respect to the protocols and the restrictions certainly played a role in it. But again, I also think, this stuff only works if the people of Massachusetts, much more broadly than that, choose to take that into account when they make their own decisions. I mean, we've said for a long time that people in their private, informal gatherings have a big role to play on this. And I do think people have taken that seriously. And I also believe that after the Thanksgiving spike, which was pretty clear and pretty obvious to everybody, that did have some impact on the way people thought about the rest of the holidays and the time going forward here.
Governor, do you have any concerns that by doing this, loosening restrictions, you are setting up conditions for the more contagious variants to spread?
So we take a good look at the data we have, and we talk quite regularly to people in the healthcare community about this issue. And let's remember that we've been assuming that the variants have been here for quite a while. Discovered or not. And they've been reported when they've been discovered, but our assumption based on the information we got from the healthcare folks was that we should be presuming, dating back into December and maybe even as far back as Thanksgiving, that at least the first variant and maybe the second one was already here. And yet we have seen dramatic declines in both hospitalizations and case counts since sort of early January. I think we obviously know how important it is for everybody to continue to be vigilant and continue to do the things that we all know prevent the spread. But I think the variants have been with us for a while during a period of time in which we have seen pretty significant drops.
Any plans to move up restaurant workers and vaccine eligibility? New York has started to vaccinate them. Now these capacities are going up. Will they move at all?
Well, keep in mind that the way we set this up in the first place was, do the things we needed to do to strengthen healthcare workers who deal directly with COVID. So that meant hospital workers, long-term care workers, assisted living workers, home health workers, PCAs, folks who work with folks with mental health issues, folks who work with folks with developmental disability issues, and folks who work with the homeless population. I mean, that was the work group and first responders. Those were the work groups that we teed up straight out of the gate. And then we included a number of other categories of really at-risk people, such as people with developmental disabilities who live in congregate settings, the whole thing associated with residents of nursing homes and skilled nursing facilities and assisted living residences. I mean, our focus out of the gate here was the people who treat people with COVID and the people who are most at risk of being significantly compromised or losing their life because of COVID. And we still need to work our way through the rest of that population. When I talked about the 1.1 million people who we are currently vaccinating, that is that community plus the over 75s, okay? And there's just no question that the over 75 community is at greater risk of hospitalization and death than basically any other group. Now, the folks you're referencing are part of the first group of what we would call the people we'll get to on the employee side after we get done with the over 75s, the over 65s, and the folks who are dealing with comorbidities, and the other folks I just named. They are part of phase 2. But we still have work to do to get through the rest of the folks who are in phase 1 and the first part of phase 2, which is this over 75 community.
Governor, given that hospitalizations are down, are you thinking about standing down at field hospital?
So I believe the Lowell site is standing down this week. Worcester still has a pretty decent census. I mean, I think it's somewhere between 40 and 50, and has been a tremendous asset to people in Central Mass and in the South Coast. And I would expect that that the Worcester site will probably stay with us for a while.
Governor, are you fairly confident that by the time the rest of us are in the queue to get our shots, that the system, all those lumpy things that you've been talking about, will all have been smoothed out and that our experience will be a lot easier?
I think we've made pretty clear that we know we have work to do to both expand capacity. We have, I think, 125 available sites now. We're looking to get up to 165 available sites later this month and are going to continue to expand as we go forward. But my view on this is that we have to have a more robust delivery system if we really want to get to the point where we can vaccinate as many as 1 million people a month in the spring, which is where we're heading. So yeah, we still have work to do.
Yesterday you said that it can take a few weeks possibly for someone to book an appointment. Now that seniors are getting their administered vaccine, they'll soon be going back to book their second dose. What's your message to them? Are they going to be able to book it in, sort of the right amount of time?
So the way most of these programs are set up, you're typically booking your second dose while you're doing your 15-minute observation before you leave. So not everybody will do it that way, but generally speaking, the goal at most of these sites, which we think is the preferred option, is to have people book when they would come back to get their second dose before they leave. Now, if the J&J vaccine gets approved, that's a single dose, and that creates a lot of possibilities with respect to how that might work going forward. If you did get to the point where you had a lot of people who don't need to come back for a second dose to be protected from hospitalizations and death, that would have a big impact on both available slots and some of the issues associated with making sure somebody does come back for the second one.
Governor, other states,
The pool testing for COVID in schools, Boston has signed up, Springfield and Worcester have not. Is there some reason why there's a reluctance for more communities to go for it? And can it be successful if everybody doesn't get on board?
I guess what I would say is that I think there are 120 school districts and schools that are sort of districts on their own that are sort of engaged in a pretty direct conversation with the Department of Elementary and Secondary Education about coming on board. Look, I think almost everything associated with COVID from the very beginning, there have been first movers, fast followers, and the rest. And I'm psyched that there are 120 schools and school districts that want to engage in this pool testing initiative, want to get their faculty and their staff and their kids tested every week, that want to do something to get people back in the classroom and provide an added level of mitigation and surveillance around COVID generally. And so from my point of view, I think that's a great start. But obviously we would like to see as many people as possible come back. And Lieutenant Governor and I this morning were up in Salem at the Bentley Elementary School, which Bentley Elementary School in Salem has had certain classes operating in person since September. And they are using a testing program that they put in place to get more kids back. And they are literally, in Salem right now, they are basically saying to families and to kids in Salem, if you want to go remote, you can go remote. But if you want to go in person, we'll figure out how to make it happen. And we were actually in a classroom where a teacher, I'm going to guess this was maybe a third, fourth grade, was teaching to what she was describing as the Zoomers, kids who were coming in remotely, and the Roomers, the kids who were actually in the classroom, and she was teaching to both at the same time. And I think the thing I took away from our visit there is if you really want to make this happen, and you are willing to try, and to be creative and to take advantage of the resources and the guidance that's available out there, you can get a lot of this done. And if pooled testing helps a bunch of folks bring kids back into the classroom and move forward, I do think that can set an example that others can follow.
So on the guidance that the head of the CDC said yesterday, teachers don't need to be vaccinated for schools to be safe. Does this put some pressure on the unions, you think, to capitulate and just go back?
Well, I certainly think the pooled testing program is a big opportunity for people who are concerned about just not knowing week in and week out what's going on in their school, even though all the data and all the research that's been done has made pretty clear that with precautions, schools are just not spreaders. I also think the fact that you will have schools that will be operating in person will send a message to others that you can do this and it can work. I also think having the CDC, for the record, has been saying for a while that schools operating with the appropriate guidance and precautions are relatively safe. They've been saying that for a long time. And I think the comment that was made by the CDC director recently would simply be sort of the next generation of representation on that, which is if schools run with the proper precautions over many months now have been shown to be safe for kids and for adults, then teachers probably don't need to be vaccinated to be back in schools. Now, they are in what we would call the first big employer group that's not directly facing COVID people in phase 2, along with retail grocery store workers and a bunch of others. But and we think that's appropriate. But I thought the comments that Dr. Walensky made were sort of the natural response to a lot of the data that the CDC and others have gathered already about what they've seen with respect to schools generally if people use the proper guidance.
Governor, as other states see a similar decline in cases that Massachusetts...
Say again?
As other states start to see a similar decline in cases that we're seeing, any plans to update our travel order and list of high-risk states?
So, you are the one who asked me about the specifics of all of the data from all of the states that's on all the multi-state scoreboards, right? We did talk about this.
The Bloomberg vaccine tracker.
No, I was talking about the, I thought you asked me about why it was that the CDC data wasn't directly.
Oh, yeah. It's
That
been
what?
a long
Yeah.
year.
So you do spend a lot. I spend a lot of time looking at the same scoreboards that you look at. And what I would say is that we have fewer COVID hospitalizations per capita relative to our case count than most other states that have the same level of hospitalizations that we have. In other words, we are finding more cases and confirming them and having fewer hospitalizations. And I would argue those two things are related. But there is certainly a trend nationally where cases are coming down in most places. Now, the slope of the line varies from state to state. The length of the line varies from state to state. And on hospitalizations, in most states, you have seen also a peak and a move over the top of the peak and are coming down. But the same thing is true there. Some have been coming down for weeks, some have just started to come down, and where they started from depends. So I would say that nationally, for the most part, case counts are coming down and hospitalizations are coming down, but the rate they're coming down and how long they've been coming down and where they started from varies a lot from state to state.
We're just hearing from people who want to go skiing in Vermont and are wondering, will that be taken off as a high-risk state at some point, or Maine, or what have you?
We talked to there's a 7-group state conversation that goes on almost every week, and people have talked about the travel stuff, but it's the sort of thing that if we were to choose to go there, I would want all 7 of these states to be doing something together at the same time, as opposed to having different states do different things, because that gets hugely difficult and hugely confusing for everybody. But it is something that we are as a group talking about.
Governor, I just wanted to follow up. Do you think we have a problem with this vaccine desert? Brockton's mayor was pretty outspoken. Have you talked about changing your strategy? I know we talked yesterday a lot about how local pharmacies in Roxbury, Mattapan, and Chelsea are going to be able to try to connect. But have you talked about changing your strategy at all? Some of this
Well, I think the goal here ultimately is going to be to provide, and remember, we're still early, we're working on the first 1 million people of something that's going to be, 4 to 5 million ultimately. The local Board of Health in Brockton and the CHC in Brockton opened up a site this week. I don't know if they opened it up. Do you know if they opened this? It got opened this week, and that is the first of what will be a number of sites that we'll be putting into places where we think we have gaps that we need to solve for. But we're going to continue to build this thing out, and we're going to build it out based on both where we can find players we can partner with and where we can find areas where we can do enough vaccinating that it would make sense for us to put a new provider in place, and we're going to try and focus to the extent we can with what I would describe, especially in hardest hit areas, folks who are considered to be trusted partners, trusted members of the community, people who will be able to encourage folks to come forward and get vaccinated. East Boston Community Health Center, for example, just started doing vaccinations this week in Chelsea, Revere, and East Boston. They have open slots, and they are working hard to fill them. Beth Israel Leahy opened up a slot this week, a vaccination site this week in Dorchester at the First Parish Church. They have open slots there. They would like to fill those. The City of Boston, we worked with the City of Boston to open up Reggie Lewis. We are going to expand that over time, and we're going to work to make sure that we find partners in the community who can help us get folks to come on in and get vaccinated, because we really want that to be a successful site for the same reason. STAR, which is a big community health center operator down in New Bedford, is doing a terrific job of vaccinating people down in their community. Some of these regional local boards and local community health center partnerships, which are really just launching, they're built on the Berkshire County model, which has been really successful at accessing and getting folks in and getting them vaccinated. But there are 3 or 4 others that are probably going to either start this week or will be operational next week. And as I said, we're going to continue to build out in the places where we have gaps, with the assumption that at some point down the road here, we're going to be doing a heck of a lot more of this on a weekly basis than we're doing now as we broaden some of the categories that are eligible.
Governor, what's the status of the call center? When will the 800 number be going live?
Well, we said it would be this week, and it's going to be this week.
What about elective surgeries? Are those still on pause?
They are on pause. Elective surgeries are on pause, but the thing I would say is that in the spring, we and the hospital community were using a far more aggressive standard around this than we've been using this fall and this winter. And there are 2 reasons for that. One is because we used such an aggressive standard in the spring, there was a lot of pent-up demand where if something at some point is no longer an elective. I mean, you need to do it. And the second is because of the number of increased COVID cases, never really had the kind of trajectory that we saw in the spring. We wanted to make sure that hospitals were still able to continue to serve people who didn't have COVID who needed to be served. And it's still in place, but it's being managed with a much, what I would describe as a lighter touch than it was managed in the spring.
Thanks, everybody.
Thanks, folks. We'll see you tomorrow.